Hello, everyone. Imagine this scenario. It's just another typical day, and you get a call from a friend who sounds shaken. He's just returned from a visit to the hospital, where he went in for what he thought was a simple case of indigestion. But to his complete surprise, the doctor revealed that he had actually suffered a heart attack several weeks ago. You're stunned and confused. How could something so serious have happened without him even realizing it? This might sound like an extreme situation, but it's more common than you might think. Believe it or not, your body often sends out subtle signals before a silent heart attack occurs. Signals that are easy to miss or misinterpret. What do cold sweats mean? Could pain in your right arm be a warning sign? Today, we're going to dive into these questions and explore the hidden dangers of silent heart attacks. Understanding silent heart attacks. When you think of a heart attack, what comes to mind? Most likely, you picture someone suddenly clutching their chest, gasping for air, or even collapsing to the ground, just like in the movies. But the reality is often much less dramatic. Unlike the classic portrayal, a silent heart attack can occur with few or no symptoms, making it easy to overlook or dismiss as something less serious. In medical terms, this is known as silent myocardial ischemia. It might seem unbelievable that something as significant as a heart attack could happen without any clear warning signs, but research shows that nearly 45% of all heart attacks are silent. What's even more surprising is that women are at a higher risk of experiencing these silent heart attacks compared to men. The symptoms are often so mild or vague that they are mistaken for other, less critical health issues. The causes behind silent heart attacks. So, what exactly causes a silent heart attack? Your heart is a powerful muscle that relies on a steady supply of oxygen-rich blood to function properly. However, when cholesterol-rich plaque begins to build up in your coronary arteries, it can create a blockage. This blockage can restrict or completely obstruct the flow of oxygenated blood to your heart muscle, leading to what we know as a heart attack. Without enough oxygen, your heart muscle cannot function effectively, and over time, this lack of oxygen can cause significant damage. The root cause of most heart attacks, including silent ones, is atherosclerosis, a condition where the arteries become narrowed and hardened due to the buildup of plaque. Several factors can contribute to this condition, including smoking, an unhealthy diet high in processed foods, and chronic stress. If you have type 2 diabetes, your risk of experiencing a silent heart attack is even higher. Diabetes can cause damage to the nerves that help you feel pain, making it difficult to recognize the symptoms of a heart attack when it happens. Risk factors you can't control. While lifestyle choices play a significant role in your heart health, some risk factors for silent heart attacks are beyond your control. For instance, if you have a family history of heart disease, your risk increases. Other conditions, such as preeclampsia during pregnancy, or a previous infection like COVID-19, can also make you more susceptible to a heart attack. Age is another critical factor. Women over the age of 55 and men over the age of 45 are more likely to experience heart attacks, including silent ones. The alarming statistics. Heart disease is often referred to as the silent killer for a reason. In the United States alone, someone suffers a heart attack every 40 seconds. That's an alarming statistic, but there's good news. Your heart is a remarkably intelligent organ, and it often tries to send out distress signals before it reaches a critical point. By paying close attention to your body and recognizing the unusual symptoms of a silent heart attack, you can take steps to prevent a potentially life-threatening situation. Identifying the signs of a silent heart attack. So, how can you tell if you're experiencing a silent heart attack? The American Heart Association has identified several signs that might indicate a heart attack, even if they don't seem serious at first. For example, have you been feeling unwell for an extended period? If so, it might not just be the flu. Persistent symptoms like coughing, a sore throat, or nausea that don't go away could be a sign that something more serious is happening with your heart. Fluid retention and bloating, a subtle warning. One of the lesser-known signs of a silent heart attack is fluid retention, which can cause bloating. When your heart isn't able to pump blood effectively, fluid can start to accumulate in various parts of your body, such as your hands, feet, and abdomen. This water retention can make your regular clothes feel tighter and cause discomfort. If you've been feeling bloated for a while and haven't found a clear cause, it's worth seeing a doctor to rule out any heart-related issues. Excessive sweating, an unexpected symptom. Sweating is your body's natural way of regulating temperature and getting rid of toxins. It's normal to sweat during physical activity or in hot weather, but if you find yourself sweating excessively for no apparent reason, even when the room is cool, it could be a sign that something is wrong with your heart. This type of sweating is often associated with heart attacks, so it's important to take it seriously. Heartburn, more than just a digestive issue. Many of us have experienced heartburn at some point, especially after eating spicy or heavy foods. Heartburn is usually just a burning sensation in the chest or throat, caused by acid reflux. However, if you experience persistent chest pain or discomfort, it could be a sign of something more serious, like a silent heart attack. While it's easy to dismiss chest pain as heartburn, it's always better to err on the side of caution and seek medical advice. Diabetic neuropathy and its connection to silent heart attacks. For people with advanced diabetes, neuropathy, a condition where nerve damage reduces the ability to feel sensations, can make it difficult to recognize the symptoms of a heart attack. This nerve damage can numb the pain that typically accompanies a heart attack, making a silent heart attack even more dangerous. In some cases, the pressure, squeezing, or fullness in the chest that comes with a heart attack may be mistaken for indigestion or another minor issue. Pain in unusual locations. When people think of heart attack pain, they often imagine it radiating down the left arm. While this is a common symptom, heart attack pain can actually occur in a variety of locations. The pain might spread to the center of the chest, the right arm, the jaw, teeth, abdomen, or even the back. This type of pain, known as angina pectoris, is different from the muscle ache you might feel after sitting for too long or lifting something heavy. It's a sign that your heart isn't getting enough oxygen and that you need to take action. Fatigue, a red flag you shouldn't ignore. Feeling tired is something we all experience from time to time, especially after a long day at work or an intense workout. But if you're feeling unusually fatigued, especially if it's accompanied by other symptoms like lightheadedness or difficulty breathing, it could be a sign of a silent heart attack. This type of fatigue is different from regular tiredness. It's your body's way of telling you that something isn't right. Diagnostic tools for silent heart attacks. If you suspect that you or someone you know has experienced a silent heart attack, it's essential to seek medical attention right away. There are several diagnostic tools that doctors use to confirm whether a heart attack has occurred. One of the most common is the electrocardiogram, ECG, which measures the electrical activity of your heart. Other tools include CT scans and MRIs, which can provide detailed images of your heart and surrounding blood vessels. Blood tests are another critical diagnostic tool. When your heart is damaged during a heart attack, it releases certain substances into your bloodstream, known as cardiac biomarkers. These biomarkers can be detected through blood tests, helping doctors confirm whether a heart attack has occurred. In some cases, stress tests or coronary angiograms may also be used to assess the condition of your heart and identify any blockages in your arteries. Treatment options for silent heart attacks. Once a silent heart attack has been diagnosed, the next step is treatment. The type of treatment you receive will depend on the severity of your condition. In many cases, doctors will prescribe blood thinners like aspirin or nitroglycerine to help improve blood flow to your heart. These medications can help prevent further damage and reduce the risk of another heart attack. For more severe cases, more invasive procedures may be necessary. One common procedure is stenting, where a small tube is inserted into the blocked artery to keep it open and allow blood to flow more freely. Another option is balloon angioplasty, where a small balloon is inflated inside the blocked artery to widen it. In some cases, bypass surgery may be required to create a new route for blood to flow around the blocked artery. The long-term effects of a silent heart attack. Even if a silent heart attack doesn't send you to the hospital, it's not something to take lightly. The long-term effects of a silent heart attack can be just as serious as those of a more obvious heart attack. For example, a silent heart attack can increase your risk of developing cardiac arrhythmia, a condition where your heart beats irregularly. This irregular heartbeat can lead to more severe complications, including strokes. Another concerning long-term effect is the increased risk of another heart attack. Studies have shown that individuals who have had a silent heart attack are at a higher risk of experiencing another one, which can be even more dangerous. The duration of a heart attack varies, but it can last from several minutes to hours. Therefore, understanding the duration and the signs is crucial for seeking timely medical help. How to reduce your risk of a silent heart attack. The good news is that there are steps you can take to reduce your risk of a silent heart attack. One of the most effective ways to protect your heart is to stay physically active. Regular exercise can help improve your cardiovascular health and reduce your risk of heart disease. You don't have to start with intense workouts. Even simple activities like walking, swimming, or cycling can make a big difference. Over time, you can gradually increase the intensity of your workouts to further strengthen your heart. In addition to physical activity, maintaining a heart-healthy diet is essential. Focus on eating nutrient-dense, high-fiber foods, especially raw vegetables. Incorporate foods rich in omega-3 fatty acids, such as salmon, avocado, and walnuts, into your diet. These foods can help reduce inflammation and improve your overall heart health. Avoid excessive snacking and sugary foods, which can contribute to weight gain and increase your risk of heart disease. Instead, opt for a piece of fruit to satisfy your sweet tooth. Managing other risk factors, such as your weight, blood glucose levels, cholesterol, and blood pressure, can also help prevent the buildup of atherosclerotic plaque in your arteries. If you smoke, quitting is one of the best things you can do for your heart. Smoking is a major risk factor for heart disease, and quitting can significantly reduce your risk of a silent heart attack. So, when was the last time you went for a regular heart checkup? It's never too late to start taking care of your heart. Let us know in the comments below.